All right, so now we're going to consider the entire pelvic girdle. And so when we look at this pelvic girdle, the three main components are going to be two os coxa bones. So we're seeing the os coxa here, and the sacrum along the medial aspect. So if we start with the os coxa, again, consider that these are their own individual bones. Each one is actually going to be composed of three bones. And so if we consider the three bones of one os coxa, making up most of the superior aspect, or actually making up the whole superior aspect, is the ilium. Making up the posterior inferior aspect, you have the ischium. And then making up the inferior anterior portion, you have the pubis. So you see the pubis bone here with its two rami. So when you consider the os coxa, please consider that those three bones make up the whole structure. As far as some of the features that you need to identify on the os coxa, you have the iliac crest that's very prominent. Right? You have the acetabulum, where the head of the femur is going to articulate. You have the obturator foramen, which in life will allow muscles to pass through. Making our way kind of towards the posterior aspect, you see here the greater and lesser sciatic notches. Separating those, you have the ischial spine, and then here you have your ischial tuberosity. Ischial tuberosity. If we come back to the pubis, you have the body of the pubis and the superior and inferior rami of that pubis bone. But again, that was the ischial tuberosity. Right, we talked about the rami, superior and inferior rami of the pubis. You see in the center here the pubic symphysis, right, just to kind of tie it in with tissues. Remember, that's fibrocartilage. Some of the other features, the spines here that you see here. So you have the anterior superior iliac spine and the anterior inferior iliac spine. You're going to see the same thing on the posterior aspect, the posterior superior iliac spine and the posterior inferior iliac spine. Right? Not very visible here are the gluteal lines, so I'm not going to kind of point those out, but you would see them on the natural bone. As far as the sacrum, some of the prominent features of the sacrum that are visible here. Along the posterior aspect, you have the median sacral crest. Lateral to that, you have the lateral sacral crests. Visible here are the posterior sacral foramina. You have your sacral hiatus. Right? And in life, all of these spaces would allow spinal nerves to pass through and pretty much exit from these regions. Going towards the anterior aspect, you see the sacral prominence, right? This nice little ridge that you can see there. The alas of this sacrum. And then here you see the anterior sacral foramina with the transverse lines extending from each one of those. And I think those are... Oh, male versus female. Sorry. So one thing you do need to do with these is be able to distinguish between male and female. And the quickest, easiest way to do that is to look at the pubic angle here. So in the model that we're currently seeing, you see that the angle is very acute. Right? It's definitely less than 90 degrees. This would be a male pelvis. While in the female pelvis, you see that pubic angle being fairly obtuse. Right? Definitely greater than 90 degrees or about 90 degrees. Right? So that would be a female. Right? And that's the quickest way to determine that.